Okay guys, here we are at Leslie's 20-week ultrasound. We're a bit late. We were actually supposed to do it at 18 weeks, but as a lot of you may have heard, 18 weeks, Dr. Annette got called away to emergency surgeries, and it was just really, really busy to get us back together. So 18 week, we're back together. How's everything going? Good. Good. You don't need to show me your belly yet. So just checking over your details here. You know, you've got your name, your address, date of birth there. Yes. And the conception date, as you all might know, was the 30th of January 2018. She had a pregnancy test on Valentine's Day. Lots of love. Okay, I know. Anyway, we're up to the second ultrasound, 20 weeks, 7th of June today, 2018. So that's all right with those details as well?
Yes.
And so the expected due date was the 24th of October. That was when we did the first ultrasound. That is what date we sort of got for that. So just procedures for the 20-week appointment. We're just going to discuss how you're feeling, so we'll probably do that now. How have you been feeling? All good?
Yeah, very good.
Okay, so just feeling, look at this, baby's coming along good there. Oh, yes. Yep, everything's good at the moment. So, you know, this is your first big ultrasound, of course, so it's important to remember that you have control of any decisions made by your pregnancy. You're allowed to refuse any tests suggested by your healthcare professional, which is me. And if you're unsure, just ask about them. If you don't understand something that's suggested to you, always ask for information about pregnancy healthcare and everything. So the technician, me, I'm going to use the transducer on the exterior of the belly to ensure your baby is developing properly. And I'm going to see how the placenta's going, where the umbilical cord is positioned. If the baby cooperates, an exciting thing, we can see everything, fingers, toes, obviously legs, arms, little face. You'll see the spine. It looks like a little string of pearls. And also you'll be able to see your baby's anatomy. So have you had a discussion with Marco whether you want to know the gender of this?
Yes.
Oh, you do? Okay. So we'll discuss that later on if we get to see it. Babies are normally very shy and like to hide things and everything. So anyway, at the moment, I know it's really hard when I push on your belly because I've made you drink a lot of water and you really need to wee at the moment. So, but yeah, it's pretty good. It's in a good position, so we're able to see everything. So just hold tight and let me know during it if you really need to go or anything like that. So at this stage, the baby should measure about 16.4 centimetres approximately, and normally approximately about 300 grams in weight. And you'll certainly be feeling a lot more movement from the baby at 20 weeks. Are you feeling lots of movement?
Yeah.
Yeah, like you said the other day, it's kicking, it's driving you cuckoo, isn't it?
Also, I've more so a bit of a punching sort of sensation.
Oh, like punching? Okay.
Yeah, like not hard, like not kicking. It's a bit odd.
Oh, okay. Yeah. Oh, okay. All right. All right, that's interesting. Okay, we'll keep an eye on that, look at that. So your hormones are working overtime, so you're probably being very moody. Nurse Tiana. There's the one.
My arm is a bit tingly.
Yeah, a bit tingly, but so your breasts will be enlarged, of course, and still very sore. So that's very normal. Sometimes, you know, well, not quite yet, but in the near future, you'll even start producing, you know, some, you know, discharge, some milky discharge, but not quite yet. Your weight. Okay, so your uterus, you know, is being pushed up now and is nearly up to like your belly button, the uterus area. So obviously, everything's getting bigger. You may feel some slight lightheadedness still and dizziness and feel a little bit vague at times. And your heart is working so much, it is like literally pumping 7 litres of blood per minute. You may even get a heat rush in this hot weather at the moment, you know, under your arms, under your breasts, even under the belly. So that's quite normal. Just basically no overdoing it, relax and chill. You'll be feeling more tired and will need to lie down a lot more, so that's pretty normal. You'll even get that lower back pain, moody, irritable, and it's a good idea to do some yoga exercise. So keep looking after yourself. Don't overdo things like I said. You're prone to hemorrhoids at this stage of the pregnancy, so make sure that you've got fibre in your diet and everything's going really well there. Plenty of fluid, drink lots of water. I know you really love water, so that's okay too. And also read the signs too. If you're not feeling well, go talk to your GP or just call Dr. Annette. I'm always available to hear how things going. And we'll just take your blood pressure. Nurse Tiana? Nurse Tiana, can you just bring in the blood pressure monitor, please? And set that up for me here. So after we do the blood pressure monitor, we're going to be doing a blood test like we usually do. And as usual, Nurse Tiana always presses the wrong buttons. She's still in training.
Off last time.
Yes, that's right. She does that. She does that. So then after the blood test, we'll do the scan. We'll check your baby's heart rate and the baby's size and everything. I'll just move this.
You can do it over there.
Okay. Okay. Just put this down like this. We've got some gawkers walking past. You might have to shut the door soon because I'm really joking. You've always got people walking past, seeing if they can see some woman in labour. I don't know. So we're just going to do this blood pressure and see how that's going. This will get all nice and tight, so don't worry about it. Your arm's not going to explode and fall off. Nurse Tiana, can you please prep the blood test? So we need the syringe, we need a face mask, we need the tourniquet. Just get everything ready for that for when I asked. She's getting that ready. How's that arm feeling?
Tight.
Okay, that's good. I like it to be tight. I like to hurt you, Leslie. Okay, so that's good. Okay, so 107/73. Is that good? Do you know if that's good?
Yeah, it's all right.
Oh, it's all right. She says it's all right. And we'll just take that off. Okay, and Nurse Tiana can take that away. I pressed it that time. Okay, so we'll just get you ready for the blood test. You've got no issues with that, do you?
No.
Okay. Tourniquet, please, Nurse Tiana. I think she's getting everything ready. She's doing really well. Hang on, while she's getting that ready, you can get the tourniquet. I'm just going to check your heartbeat. Here we go. Okay, good. Excellent, excellent. Happy with that. So you've been feeling relatively healthy. Everything's going well.
Yes.
Okay, so just put your arm up there. Just try to relax as much as possible. I'm doing this wrong. I'm just going to pull that a little bit tight. So just scrunch your fingers up and down, and into a fist. Just hold it into a fist. Okay, just relax that for a minute. I'll just get my gloves on. Should learn to stop wearing these big rings. Put that down. You don't even have your gloves on. It's not very sterile. Or your mask.
I haven't touched it.
Put your mask on.
Request a new nurse.
Put your mask on. Put your gloves on, and go and get a sterile syringe, please. Just from out there. Just from out the box. We've got to make sure she's very sterile. Okay. Have you lost one? That's it. That's it. Yep, that one. Can I have the syringe this week, or that's the one? Yep. No. Yep. Yep. Okay, I'm just going to just clear the area. Just clean it. Make sure it's all clean. Just with a bit of sanitizer. You can take that back. Okay, just hold on there for a minute. Okay, so I'm just going to tighten the tourniquet. A little bit tight there. Is that all right?
Yep.
Just feeling for the vein. Okay, so it's just going to be a little pinch. Very quickly, not much today. So just relax there. Good. Okay, all right. So not much blood today. So, oh, sorry, I didn't get to anyone to look away if they weren't ready for that. So Nurse Tiana, if you could just put that in the specimen box, ready to go out yeah, just for the pathology collection. Thank you. Okay, so I don't need this right at the moment. And can you just take my mask away? Thank you. I'll be fine with that. Okay, so that we'll just send away to pathology, like I said, and we'll get the results back. Just checking on a few things there. So getting ready for the scan. Just get my ultrasound machine up. Nurse Tiana, the passwords are... I'm not normally in this room. It's normally her room. And can we have the colour screen up on this, please? Is that this one? Or is it as bright? Oh, okay, that's much better. Okay. So I'm just going to put this across your lap, just so we don't get anything on your trousers. Oh, we're definitely getting nice and big there, aren't we? Okay. I'm just going to put some ultrasound gel on. Oh, jeez, I often get that spilt everywhere. That's all right. Down there. And if I can have the wireless Doppler. I'm just going to put that at the edge of the tape bed. And I'll just turn the screen around so everyone can see. Pepsi Max there. Must have been from the last doctor. So hopefully everyone can see, but at this stage it's just really for Leslie and to make sure everything's going okay. Should be right. Oh, there's baby. Look at it there. Very cute. So this is, you know, as you can see, the head, and there's the face. There's the nose, the profile there. And then we've got the body. Okay. Just the heart there. Just a bit. Shake it around there. Move around there a bit, baby. Going okay. Just going to have a look, good look at this. There's just the heart there, you can see on screen. There's the heart there. Okay. Now I'm just going to do the heartbeat, is that okay?
Yeah.
Nurse Tiana, if you could just come here for a moment while I do the heart. Nurse Tiana, could just go to the front there and just hold on to that. Well, you'll need to turn the heart monitor on. Okay, and I'm just going to keep this going. Are you ready? Is that on?
Yep.
Sound up.
I'm turning it up.
I think this wireless monitor needs to be charged. But you can hear the baby's heartbeat there. Okay, that's nice and strong. Okay, just turn that sound down off that again. Okay. All right, Nurse Tiana, would you mind just go and getting the obstetrician, Dr. Michael, in here for a moment, please? Just going to get him to have a little look at the screen for a minute. Nothing to worry about. Yes, Dr. Michael, come in.
Hello, Doctor. What's your concern here?
Yes, I just wanted to get you to have a little look at this, please. So we've got some. I just wanted you to check on that.
Oh, yes. No.
Okay, so I'll just show you this. I'm just going to switch this back on. So if you could just have a look at this for a minute. Just for a minute.
No, that concerns me.
Okay.
Could I have a word with you outside for a moment, please?
Yep, no worries. Okay. Nothing to worry about. I'm just going to talk to Dr. Michael outside. Tiana, could you just clear up the Doppler there and print out the ultrasound scan that I've got prepared? Yep, no problem. Okay, yeah, I'll arrange that. Yeah, I'll arrange that appointment tomorrow. Okay. Thanks, Dr. Michael. Okay, did you press the print out for that?
Yep.
Okay, great.
My tummy's getting a bit cold.
Well, it's getting a bit cold. Nurse Tiana, you're supposed to look after her in that sort of situation. We can pull that down. It's a little bit of gel there. Okay. So are you still comfortable?
Yes.
Okay. Okay, so things away. Walk away. Okay, so basically a few situations from today. The heart rate is 180 beats per minute, so that's really good. Uterus measurement is like the size of a large papaya, but your health is really good and everything. So anyway, well, as you know, I was just speaking to Dr. Michael, and there's a few developmental issues that he would like me to discuss with you. Now, as you know, I've got other ultrasounds I need to do. So are we able to reschedule an appointment for tomorrow morning to discuss everything about your baby? So we'll talk about, the length and everything, the sex, everything like that. So are you available, say, 9 a.m. tomorrow morning?
Yes.
Okay. So if you could come back then, bring Marco with you if possible. Looks like Tiana's just printing out an ultrasound at the moment. I think she's waiting for it to happen. So just bring Marco with you if you can, and that's it at the moment. We'll leave it at that. Don't get worried or stressed about anything at the moment. It's just best that we discuss all the options with everything and just make you feel comfortable. So is that printed out?
No worries.
Okay. Wonderful. So there is a picture of one of the ultrasound pictures of Bubba.
Mm-hmm.
And there's the 3D image. So I'll just show everyone on the screen. There's the ultrasound image and the 3D image. Very, very cute smile there that baby has. All right, so we'll see you in the morning. Nurse Tiana, if you could just finish up everything and help her get the sheet off her and help her up if she needs a little bit of a help up. Okay, we'll see you later. See you tomorrow, Leslie. Have a good night.
Thank you.
The sheet on there. Stop winking at the camera. Stop whining at the camera. I need to get the belly in, which I will at that angle. Oh, you did have to move things, didn't you?
A little bit.
Yeah, it's just a dodgy camera. Can I have the syringe this week or? Okay, so I've got the syringe there. Okay, Tiana, take this back I'll have to cut that out. I need you to...
Dad's here, I'll send the doctor's telescope.
He has to wait. It's not time yet.
Oh, she's got...
And I'll let you borrow mine.
No, that's a pink one.
Well, you have to borrow mine. You left yours in the office. Tiana, is your gloves on? Is your mask on? I have to cut all this out. What doing? Ah, yes, Dr. Michael, would you just come in here for a moment? Just.
Yes, what's your concern? Yeah, that's... Yeah.
So if I just for a minute, just have a look at what with this.
Yes, that's not correct. No.
Okay, hang on. I'll just take this into. Just be back for a moment. Redo that.
Yeah.
Okay, hang on a minute. We're redoing that.
That
Hang
was
on.
good.
He reckons it's not good.
I thought it was perfect.
I'll try it again.
He wants to try it again. He wants to try it again. No, leave it there.
Oh, okay.
Get out.
Take two. Where's the snap thing? I fell over.
Should we check in this one? Okay, that's fine. Okay, watch out. Get out.
You're a doctor or a nurse?
I'm a doctor.
Are you sure about that?
I'm a nurse.
Okay.
You're an
She's an
obstetrician.
you're an
No,
obstetrician.
wait, yep.
Able to hear how things going.
What?
Now I want you to come over here. There's a sheet on there. And help her up, like. Look the other way. Okay, that's it.
Aren't you going to tell us?
I've just organised an appointment with her tomorrow. That's when I'm discussing it with her.
You know how it's got two photos there?
Yeah. There's supposed to be a line between that.
Oh, so, because it looks like there's twins.
Yeah,
Wait, when we were laughing.
don't knock that. Okay? Whatever you do.
Well, how you
Tiana, I need you to be ready.
Where'd that bassinet come from?
That's my Silver Cross pram.
That's bassinet number 365.
No, it isn't. Get out. It's recorded. That's... It's mad. Now here's the blood, so do not knock it.
It's so funny.
Oh, shit.
What?
She's going to start laughing.
I'm
Shit.
not. It's been 8. Maybe we all need masks on. It's been 8.
Finally, it's been ages.
It's been ages.
Okay. It has been 8.
Okay, quiet. Yeah, it's the pregnancy team back together. Hang on, Tiana, come here for a minute. We'll just do a still.